Women are at the center of life. We give life. We nurture. We care for our children. We dance. We sing. We grow. Why is it then that, statistically speaking, one of the women sitting next to you, your friend possibly, will die from heart disease? What is different about you and me? What is different about our hearts? The Women's Heart Foundation wants women to know about these differences so they can pass the message on to tell other women, and so on. Bonnie Arcus is the Executive Director of the Women's Heart Foundation.
Hello, my name is Bonnie Arcus. In 1986, my mother died after suffering a heart attack on Mother's Day and subsequent heart bypass surgery 9 days later. That day changed my life forever. I was angry about my mother's death, and I felt deceived by the medical profession that I, as a nurse, was so much a part of. Before surgery, my mother was given a 99% chance of survival. It wasn't long after my mother's death that I founded the Women's Heart Foundation as my personal mission to investigate why medicine could not save my mother and so many other women. Women were dying from heart disease procedures at a rate much higher than men. I learned many things, and I shared many life experiences with survivors who now work with our foundation. The program you're about to see is about our foundation and what it is doing to change the way women are diagnosed and how they receive care. We are not a big organization, and we are only as strong as the support we receive. Our message about women's heart health is important. Heart disease is the #1 killer of women. It presents differently in many women. Women need to know. And so we're asking you to help us reach mothers and daughters, sisters and wives with our life-saving message.
Heart disease kills women at an alarming rate. For every woman who dies of breast cancer, 27 will die of heart disease. 1 out of every 10 women between the ages of 43 to 64 has some form of heart disease already, and 1 out of 2 women will die from it. Heart disease is the #1 killer of women over 34. It has become the silent killer of women, and it is at epidemic proportions. Determined to educate women about heart disease and wellness, it partnered with Robert Wood Johnson Medical School to sponsor a medical conference on gender bias. These and many other efforts have received overwhelming support and attention with local, state, and national proclamations. Gradually, it began telling its story to a national audience.
Heart disease kills 1 out of every 2 women. You need to know that, and in every conversation you have with every woman that you're going to see in the next month, you say, by the way, girl, did you know heart disease kills 1 out of 2 of us?
The Women's Heart Foundation was the principal resource of information for an hour-long segment on women's heart disease that aired on the Oprah Winfrey Show.
Dr. Oz says that women's hearts are very different from men's. Physically so? Are you talking?
It's fascinating, actually. As a heart surgeon, I get to touch the heart every day. And when you look at these little arteries that give blood flow to the heart muscle, you realize that in men, they're like rigid pipes a lot of times, the kind of pipes that come out of your sink. And that mindset that the heart clogs off its arteries because it's sort of like getting some hair stuck in your sink is probably not that inaccurate for men. But for women, it's wrong.
Really?
Because when you touch the arteries on the surface of a woman's heart, it's soft usually.
And the foundation's exposure did not end there. Locally, it was given platforms to tell its story.
Noreen Daly Carson of Essex County was visiting her father in the hospital when she suddenly felt sick.
She had lightheadedness, palpitations, and sweaty palms.
Catherine Jankowski says her sister then collapsed. She recalls what Noreen was told in the emergency room.
You need to see a psychiatrist. You need to take some things off of your plate. You're too stressed. You're doing too much.
But Noreen, who is 47 years old, was having a heart attack. She died a few weeks later, leaving 2 children and a husband.
Doses can be deadly. Women have a 50% chance of dying from their first heart attack. Of the women who actually survive that first attack, 38% will die within a year.
They care about their husbands and their children before they care for themselves, and they're not putting their own health first.
Our volunteers spoke out on their personal experiences with heart disease.
It wasn't pain, but it was discomfort. I asked for an EKG, and as far as I'm concerned, I wasn't seen quick enough.
And the experiences continued to grow. The Women's Heart Foundation's signature event, Women's Heart Week, was an overwhelming success and received both state and private support.
Now, therefore, I, James E. McGreevey, Governor of the State of New Jersey, do hereby proclaim February 1st to February 7th, 2003 as Women's Heart Week in New Jersey.
More than 1,000 women attended Women's Heart Wellness Day, the inaugural event of National Women's Heart Week. The event succeeded in reaching hundreds of thousands of New Jersey women with a powerful message about heart disease. Nationally, the foundation has reached more than 42 million women with its message.
We're proud of what we've accomplished, and I can assure you that we are not going to stop there. In the coming years, we plan to establish community-based wellness centers and to recognize member hospitals that attend to gender-specific care needs in this state and others. We're working to encourage even more support for Women's Heart Week this year because the rising death rate in women is of monumental concern. We're taking a gender-specific and systems approach to this healthcare crisis. Women's Heart Week presents an opportunity for early intervention. We will assist hospitals in planning Women's Heart Week and support them to become Women's Heart Foundation member hospitals. It's all part of our Healthy Heart Network community. The future for heart care for women is now. Please join us. Help us save more women's lives.